Hi, my name is Dr. Katie Michos, and I'll be talking to you today a little bit about grief and things that you can do when you're grieving and in the mourning process. The loss of a loved one is something that produces a variety of feelings and thoughts and changes for people. It is something that everyone faces throughout life and can increase in frequency as we grow older. There's a researcher out there named Warden who talks about what grief is. He explains that it encompasses the thoughts, feelings, experiences that a person has related to the loss of a loved one. Grief is something that is a process and it does take work. There are different factors that can influence grief. Some of these may include the relationship that the person had with the loved one that's deceased, the personality characteristics of the mourner. Is there social support available for the mourner? What are some of the other simultaneous stressors that are happening for the person as well? And in addition to that, cultural, religious, and individual differences. Now, there are common manifestations of grief. These include different emotions, physical sensations, and behaviors. Emotionally, people can feel angry, sad, guilty, anxious, even sometimes relief. Physically, the person can get stomach aches, muscle tension, and sometimes feel the presence of the person around them. And behaviorally, sometimes people can be crying, they start to isolate and socially withdraw, in addition to wanting to be closer to the deceased in some way, or even try to avoid reminders of the deceased. Sometimes grief can turn into complicated mourning, and this can be in a variety of ways. One common way is through developing some sort of depression or anxiety disorder. So what's important, as Warden explains, is to go through the 4 tasks of mourning. This includes accepting the reality of the loss, knowing that it's irreversible and permanent. 2, working through the pain of the loss, being able to experience those feelings and direct them in a positive way. 3, adjusting to the environment where the person is dealing with not having the loved one anymore, and this can include spiritual changes and also life role changes. And finally, to find a way to emotionally relocate the deceased so that the person can still have an ongoing relationship and bond with that person, even though the person is no longer with them. And in addition to this, people have to realize that grief is a process. It's something that can't be rushed. And if you can be gentle and compassionate for yourself, that will also help throughout the process.